Delia Grace, a veterinary epidemiologist and food safety specialist working with the International Livestock Research Institute, says livestock plays a big role in nutritional security for people.
Livestock don't contribute a lot in terms of calories, but in terms of the essential nutrients, these are high-value proteins, micronutrients, vitamins. They're particularly rich in livestock and animal source foods. And so here, even small amounts of meat, milk, fish and eggs can be very strategic in helping people meet their nutritional needs.
Delia also says livestock is a major source of income for poor people and those involved in value addition.
From the research we've done, we know that more than 1 billion poor people depend upon livestock for their income. And that's a lot of people, and it's a lot of potential for getting additional money into the household to buy food. And we know among the poorest that one of the main expenses they incur is for buying food.
However, contact between livestock and humans portends risk.
The pathogens, the germs you find in meat, milk, fish, eggs, and then also zoonotic diseases, the diseases which are shared and transmitted between people and animals, whether they're the neglected common diseases which are sort of there all the time but are just often not managed, or whether they're the emerging diseases, the new diseases.
There's a very common one which we call Q fever, also which is common in Kenya. Of course, this infectious disease like Rift Valley fever can cross to humans. Even other parasitic, like just tapeworms, like cysticercosis, in pigs or in cattle, it can also infect humans.
We've done quite a lot of studies, and there is no doubt that the most important ones are the ones which are found in food. So just in cases of, the human cases. And those are things like Salmonella, Campylobacter, E. coli, Listeria.
Salmonella is a group of bacteria that causes food poisoning. It is caused by eating raw or undercooked meat, poultry, eggs or egg products. Those at risk include young children, the elderly and people with weak immunity, like those with HIV/AIDS or those undergoing cancer treatment.
At ILRI now we have a project which we want to roll out use of e-technology, for example mobile phones, where we encourage people to report cases whenever they occur of maybe infectious diseases.
Animals also get diseases from humans. This has resulted in a sharp decline in livestock and their productivity in the developing world.
What we want to do is we want to help them keep those livestock better. At the moment, up to 1 in 3 of those livestock dies every year from preventable disease. We want to get the vaccines, the animal health services that will stop those animals dying.
For example, a cow in the semi-arid area in Kenya, Uganda or Tanzania will produce only 4 liters of milk daily, compared to one in Europe which will produce 40 liters a day.
Assuming we could bring that production up closer to the European level of 40 liters of milk a day. So that means instead of having 10 cows, which each produce 4 liters and together produce 40, but who produce a lot of greenhouse gases and eat a lot of food, you would replace those 10 cows by 1 cow, which would produce the same amount of milk. Sure, it would eat more food, but it wouldn't eat as much food as 10 cows. And sure, it would produce more greenhouse gases, but it wouldn't produce more greenhouse gases than 10 cows. And so by actually decreasing the number of cattle, but increasing the productivity, you could get a win-win. Fewer animals, but actually more production, more meat, milk, eggs.
According to a new consensus report by UN Intergovernmental Panel on Climate Change released this Sunday in Copenhagen, greenhouse gas emissions are said to be on the rise. According to the World Health Organization, greenhouse gas emissions contribute to climate change, which between 2030 and 2050 is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea and heat stress. Methane in form of carbon dioxide mostly released by cattle, sheep, buffalo goats, pigs and poultry is one of the most prevalent greenhouse gases. A leading exponent of the One Health approach, Delia says this practice can mitigate infections between animals and the humans. One Health has been defined as the collaborative effort of multiple disciplines, working locally, nationally and globally to attain optimal health for people, animals and the environment. Under EcoHealth, supported by the International Association for Ecology and Health, as well as the International Development Research Centre in Canada, scientists, researchers, medical workers and the general public converge to promote the One Health approach. According to the International Livestock Research Institute, the approach can add value and reduce costs in 5 potential areas, including sharing health resources between the medical and veterinary sectors, controlling zoonoses in animal reservoirs, early detection and response to emerging diseases, prevention of pandemics, and generating insights and adding value to health research and development. Florence Nalimba, NTV.